Hi there, welcome to Law and Justice. I'm Jane Mulcahy. This is a special series on the topic of relationships matter, and today I am so pleased and excited to be joined by Georgie Oldfield. How are you, Georgie?
I'm very well, thank you, Jane.
Thanks so much for agreeing to come on the show. And we're going to talk today about something that I haven't really covered before, which is chronic pain. But before we get into that topic, maybe you can tell me a bit about yourself and your background, please, Georgie.
Yeah, absolutely. I am a physiotherapist and was worked in the NHS for many years until I think it was 2005. I set up my own clinic, and that was really because I became more interested in chronic pain and wanted to find a way of doing more to help people with chronic pain. At that point, having started out as a respiratory specialist, I was actually ending up working as in the community. Mainly because I had young children at the time, and it worked really well with having young children and being flexible. And then became more interested because I was feeling frustrated that there wasn't enough that we could take out to people in the community to actually really help with chronic pain.
Mhm.
And at the time, I was as frustrated as most people are when they're working with people who have chronic pain, because there was so little that we could do to help except help them manage it. And I was
Mhm.
never happy with that. Why
Okay.
should we just help people manage chronic pain? And really, I just started becoming interested. I started becoming curious because there were
Mm.
so many anomalies that just didn't fit. Like, people are saying, "Oh, I've had back pain for 5 years." Oh, what happened? How did it start? I don't know. I just woke up with it.
Wow.
Okay. Yeah.
Okay.
Or no, I'm fit as a fiddle, but I bent over to pick up a pen one day, and my back went, and yet they were going to the gym without any problems.
Hmm.
And then on occasion, lots of times there were people with chronic pain who came to me who there was no physical sign, no injury, nothing showing on MRI scan. And that was sort of okay, what is going on here? And then on the other side of the scale, there were people with really severe signs of spinal degeneration, for example, moderate to severe. And that was blamed on the pain, even though the symptoms didn't really fit the diagnosis. So it might be were told they'd had a prolapsed disc, but they were getting
Hmm.
pain on both sides, down both
Okay.
legs, for example, which doesn't make sense.
Mm.
Or pain would move around, things would move around, and one day there was just so many things I was trying to answer. But anyway, eventually I came across the work of Dr. John Sarno. So he was a rehabilitation specialist in New York, and I read his book. I just had an epiphany. It just made sense. It answered all the questions I had about all the recurring health things that I had, waking up with back pain or
Okay,
uh,
right.
gallbladder pain, for example, and just thinking, oh, it runs in the family. My mother has it. That's it. Never really questioning, and I don't think we do until we
Mhm.
realize there's something else might be involved. Never really questioning, well, why have I got my gallbladder pain now? And then just,
Yeah.
I then blaming it on something that I'd eaten, even though for the previous few months I'd been eating the same food.
Uh-huh. Right. So was there
So,
maybe, sorry to interrupt you, was there
no,
maybe a stress link with that type of
oh, yes.
yeah,
Oh,
okay.
yeah. A stress link and a link to old unconscious patterns that
Uh-huh.
we'll probably come on to.
Yes.
So, yeah, absolutely. Things that I was not aware of at the time,
Hmm.
because quite often the triggers are very unconscious.
Yes.
So I was being told frequently by people, it's the mattress or it's the pillow. And I went through, I have to admit, probably a dozen orthopedic pillows myself
Okay.
because I believed I had a bad neck and nothing
Yeah.
helped. So I'd say to a patient, "Why don't you try this? It didn't help me, but maybe it'll try
Your
you."
neck might be wonky in a different way. Yeah.
Yeah, yes,
Yeah.
absolutely. So there were just things like that. And when when it always sounds ridiculous when you see the light, but when I started to understand, I look back and I could then see. I couldn't remember every event, but for example, when the first time I had the gallbladder pain that was triggered
Mm.
after I realized, I was eating a meal. I remember being sick and going to bed early and thinking, hang on, why now?
Mm.
And then I looked back and I thought, when have I had it in the past? And I could remember only one. I could remember I had it loads of times, and I'd been for tests, all sorts of different scans and things. And I was heading for my gallbladder being removed.
Oh, wow.
But I could only think of one really big event. And we're going to be talking about repressed emotions. So I'm
Mm.
going to give you this as an example.
Yeah,
Although
please. Yeah.
I always feel like I have to be cautious.
Hmm.
Um, but my mum's 92 now, so I don't think she'll listen to this podcast.
Yeah.
Um, but it was when I'd just had my son, and I'd had a pretty traumatic delivery. It was my first child, and she came to stay with me for a week, and it was lovely. First few days, I couldn't do very much. It was lovely, but then you start feeling like just want to be a family.
Yeah.
And she's very motherly and a very affectionate mother, but it was feeling like a bit too much.
I get you.
Because once I could get going, my husband would come in and say, "Would you like a cup of tea?" And then my mum would jump up and say, "I'll make it," which is, again, it's lovely, but
Mm.
it meant that my poor husband didn't know what he could do, what he couldn't
I get
do.
you.
And even though she'd said to me, "If you want me to go home early, just tell me, I'll get an earlier train," because I know what it's like. I also know what my mother's like, and she would have been offended. And so I
Ah,
stopped myself from saying anything. The
okay.
morning she was ready to go, it was like my stomach had exploded. I was in agony. I couldn't even get to the
Mm.
toilet. I was in so much
Wow.
pain. The doctor had to come out. He didn't really know what was going on. And my mother's saying, "I'm not leaving you now. I can't go."
Oh, I'm sorry. I shouldn't laugh.
I don't know. I
It's
know it is funny now
unfortunate.
when you
Yeah.
think about it.
Yeah.
And it's all these patterns from
Yeah.
childhood and everything. And I just sort of said, "No, I'll be fine, honestly." And interestingly, within a few hours of her going, I was fine. And I didn't have
It's
that problem for a
dreadful.
long time. I never questioned it. I mean, my son's 34 now. It was a long time ago.
Yeah.
But I know, and you don't. When I woke up with sciatica, and again, I couldn't put my shoes and socks on for 3 weeks. I just assumed, again, it must be something going on with the bed. I'm a physiotherapist. I was trained physically.
Yeah.
Had to be something physical going on. And I remember having been told about somebody who was a craniosacral therapist who used somato-emotional release. And I had a client where the symptoms didn't really fit. All the pain was down one half of the body,
Mm.
not down the other half. It was all down the left side.
Mm.
And that doesn't fit anything. And that's what we look out for now. But at the time, it was like, what's going on? I don't understand this. And so I said, well, I'll try and help because I'd been recommended. But after 2 or 3 sessions, I just said, I don't really think I'm the right person for you. But I've heard about this lady, and I'd reached out to our online community of physiotherapists, the Charter Society community of physiotherapists, and they were all saying, "Have you thought about craniosacral therapy? Maybe try that." I hadn't, because I'd not really heard of it. And I asked the patient and the craniosacral therapist if I could sit in. And one of the questions she asked was something I had never asked a client, which was, what was going on in the lead up to the symptoms developing?
Mm.
And I was going, oh my goodness, that's interesting. And she said her husband had died. And the symptoms had come on soon after, and it's all down the heart side. And the
Oh,
craniosacral therapist was trying to explain this. I'm sitting there going, that's interesting. I just left the NHS. I've just set up my own business. My husband's self-employed. And it just began to make sense that otherwise, why would you wake up in
yeah.
severe pain when you went to bed absolutely fine? This lady wasn't ready for it. Whereas at the end, I said, I don't suppose I could book an appointment with you, could I? Because I've got sciatica. 2 or 3 sessions in, it had gone. And
Amazing.
that started me beginning to think about emotions, not yet trauma,
Mm.
unresolved trauma, but emotions. And when I came across Dr. Sarno, it was just like the light bulb went on, and it explained about me, about so many of my clients, and about all the anomalies that I was seeing. And for me, I just couldn't leave it at that. I had to look further.
Thanks, Georgie. That's a great introduction. And obviously, I had the pleasure of hearing you speak this year at the Trauma Summit in Belfast, and I met you the previous one, but hadn't heard this fascinating work. And it is an interesting added kind of dimension because lots of times people talk about trauma as it at being a kind of more psychological phenomenon, but it
Mm,
appears to me that it kind of impacts absolutely everything from
Yes.
the nervous system, brain development, our emotional health, and ability to even recognize what emotions we're feeling, or pushing them down,
Yeah.
banishing them,
Absolutely.
and also then our capacity to relate to others. And even that anecdote with your mom is very interesting, because you didn't want to hurt her and she wanted to respond to your needs, and
Yeah.
just that inability to express at times, and
And be authentic.
yes, that harms us all, really,
Yeah.
ultimately. But to go back a little bit to your training, it seems that you didn't have a lot of this knowledge. You said you were trained in the physical, which makes sense. Physiotherapy, to
Mm.
anyone who's ever done any session, it is all about the body. And I'm wearing my Jack Skellington Christmas jumper because of the skeleton, I suppose, and muscles and all of that. People mightn't see any connection to
No,
emotions or
no,
traumatic
quite.
memories.
We learn all about the nervous system.
Oh, you do? Okay.
Oh, yeah, the nervous system, but not in relation to emotions or anything.
Okay. Right, right. And has that changed now over the years? Because I mean, I certainly have become aware that even within mainstream um, mental health training or mainstream physical health training, really not all of these things are brought together. So people
Mm.
mightn't learn about what safety is, what it feels like in the body in connection to one another,
Yeah.
in our relationships, in the world, attachment, how we develop these patterns of relating that you kind of discussed as well. Do you think that is becoming more part of physiotherapy training now?
I think sadly not.
Oh,
I think the part that, and this is because when we look at
hmm
the pain science is catching up.
okay.
The trauma science absolutely demonstrates the link between adverse childhood experiences, past trauma, and then the way we appear in the world and the unconscious patterns we develop, and the ill health, the risk then to ill health in later life. But there's not many people working with pain
Mm,
that actually incorporate that. Now the pain science has evolved and it's supporting a lot of the work we're doing. And it certainly will see that emotions are impacted by the pain, that
hmm
we could then become very anxious or depressed because we've got pain, and recognizing that fear and worry and anxiety can exacerbate pain, but they're still not looking at the trauma side. So
okay.
there's really, the pain science is great. It's really demonstrating the impact on the brain, for example, from how past experiences can impact the brain, and also the factors that cause pain to persist,
Mm.
like anxiety, fear, faulty beliefs, cultural norms, that sort of thing. But rarely did they go into the actual trauma, looking at underlying trauma. And as far as I'm concerned, if there's been significant trauma in somebody's life, or that the past experiences that resulted in them experiencing trauma
Mm.
has an impact in chronic pain, then how can we get to the bottom of it and do more than just manage pain without really exploring what the precursors were to them actually developing pain, as well as the triggers and what's perpetuating it now.
Yeah. And so you mentioned John Sarno's book. How did that help you kind of bring the emotional repression and trauma and I suppose the body more generally and pain together?
Because he, as a rehabilitation specialist, had since the 1970s come across this realization
Okay.
that so many people who had of the patients that came to him, he actually started wondering what was going on, and he started looking at past notes of patients that he'd had, and seeing that there were quite a lot of patients, 88% actually, of
Wow.
patients that came to him with chronic pain, who also had a stress-induced condition, maybe like IBS, for
hmm
example. And so he began to think, I wonder if this is related to unresolved emotions as well.
Okay.
So he got together with a couple of psychotherapists, and they did begin to recognize that the this unresolved trauma, unresolved emotions were manifesting as chronic pain, as part of a protective response.
Mm.
Because if you, let's say you grow up with an angry dad,
Yeah.
he's very volatile. As we know through all the trauma work, we then start developing coping mechanisms, protective mechanisms to cope with that. But we begin to recognize that, have a fear of anger, and
Sure.
not just if somebody is angry, but also if we are angry and we've been shut down, we
Mm.
learn to repress this emotion.
Mm.
And then if this is triggered in later life, because the emotion has been linked to a threat to, something we need to be protected from, then if anger is triggered, then actually that can create a response, because this is an emotion that is a threat, perceived to be a threatening emotion.
Yeah.
This will unconsciously be shut down so we don't feel it, but then actually we might have a migraine or back pain or something that develops instead. So
Mm.
this is something that he recognized, and he explains in his books. They're rather dated books now. His theory was that the pain was due to hypoxia, not enough oxygen to the tissue,
Oh.
which I think could be very relevant,
Mm.
because actually when we are tense, when we're frightened, angry, whatever, things tense up.
Mm.
And then there won't be as much oxygen going to the tissues, and we know that that can cause pain
Mm.
with this muscle tension. But there's been no evidence to prove that that hypothesis is correct. And actually now the pain scientists have all agreeing that actually this is about neural pathways that have become learned and sensitized,
Ah, okay.
and therefore they will be more easily triggered. So, for example, if somebody has had an angry dad, and learn to sort of be very careful around them and keep quiet, and were shut down if they were angry, then they could just be a really nice, kind, lovely person who outwardly
Mm.
and to them are a very calm, quiet person, because it's just unconscious and shut down. But it could be, for example, and I've known this, where a patient was in the office where, just getting on with some work, and remember, if it's the dad and if it's an older man who then
Mm.
gets angry, that could even more sort of trigger these unconscious pathways. And she was in the office, and her boss hauled in one of her colleagues, and she could hear through the doors him shouting at her. Now, that would be a real trigger for her,
Mm.
but she's in an office. Okay. So, and if she's got no somatic awareness, no awareness anyway that
Mm.
she's been triggered, then she would just might feel uncomfortable, but just carry on with her work. But it might be later that day or even the next morning, where all this is being processed, that might trigger a pain, whether it's migraine, back pain, or whatever it happens to be, sciatica.
Mm.
And then if you've got no understanding of this or no somatic awareness, you might not recognize at all that the pain was a manifestation of this unresolved
Yes, of
anger
course.
that was triggered maybe the day before, for example. And then if you go down the physical route and then start having scans, and they go, oh, you've got a prolapsed disc, which actually, 60% of 50-year-olds, I think the study shows it's about 60% have a prolapsed disc, slip disc, then,
Okay.
it's coincidental. It's a coincidental finding. But if that's the case, then they will have then fear. And studies have shown that if you have scans and it's showing something in the scans, the way they're explained to you means that there's more fear and more worry about you getting worse, and that fuels the pain, and it can persist because nobody's actually recognized that there's a different underlying cause.
It's so fascinating. I'm remembering your talk here, and the fact as well that we invest so much in health and safety in offices without recognizing again that our emotions are so frequently the vehicles of our health or our ill health, depending on how we respond to them. When you were talking there about anger, it made me think of just how we rear children in general, how women and girls are not really reared to accept being angry in
Yeah.
themselves. It's not a
Yes.
pleasant emotion to have an angry woman or to be
Oh,
described as an angry woman, whereas it's quite acceptable to be an angry man. And it's
yes.
not okay to be a soft, gentle, kind sensitive man.
Sensitive man.
They will be told to man up very quickly as a small
Yeah,
boy. And
yeah.
does this then show up later on potentially in different types of pain based on gender or more propensity for certain types of pain, Georgie?
I'm not sure that it's particularly a different type of pain depending on the individual. I
Hmm.
think unless it's something like anger, that often is a tension type of
Hmm.
pain rather than fatigue, for example.
Okay.
But there are theories, metaphysical anatomy will talk about specific symptoms being related to uh, uh, a certain emotional things that are going on, which
Hmm.
I find fascinating and I find amazingly accurate
Right.
because I will look at it, whether I've got a patient or somebody talks to me about it or I develop something.
Mm.
It's just really interesting when you start to look at that.
Yeah, and I know from having gone to for massage and reflexology at times that certain, you mentioned the gallbladder, but I think the liver as well as are some parts of the body more associated with anger than others as well. That,
Yeah,
yeah.
absolutely. And if Gabamati talks about specific conditions
Mm.
that go with specific personality traits,
Mm.
and that makes sense as well.
Yes.
And you really can see that. And I just find this just still so fascinating. I don't always remember the exact uh, emotions related to specific symptoms,
Hmm.
but we have a metaphysical anatomy book that I would normally look into and just see. But I think it's invariably correct. And it's
Yes.
just, I think it's not absolutely necessary to know, but I think it's interesting to look because it might help you. For example, wrist pain, I know, is about one of the areas that it can reflect is being a buffer between two people.
Right.
And so if you know that, then it can be easier to explore and think, okay, how does that fit with me?
Hmm.
Or sinusitis, what's getting up your nose? And it sounds ridiculous, but oh my goodness, it's so correct. When I've explored it, even if somebody will say, and I have had a patient who said, no, no, I'm very tolerant. I'm not
Mm.
intolerant if it's what gets up your nose. And
No.
yet I knew that wasn't the case because somebody had moved in next door and she was often talking about the noise they made and
Mm.
that they don't seem to understand and whatever, and that was getting up her nose. But because she's a very forgiving person who's working on not being judgmental, she just didn't recognize that deep down that was a
It was
trigger for
bugging
her.
her. Yeah.
It was really bugging her, and that even just talking about her made her nauseous. So that in
Very
itself
interesting. Yeah.
was very interesting. Yeah, absolutely.
And you mentioned Gabor Mate there as well. His stuff around the personality traits of people who develop autoimmune conditions is very interesting as well. How
Fascinating.
they're three-quarters women and in death notices will be described as so lovely and kind and put everyone ahead of themselves and never said a bad word about anyone. Again, repressed anger
Yeah,
and
yeah,
anger turned inward. It does make sense can
yes,
attack the body and the muscles or the organs or whatever and kind of scream something is not right with me. It's just as you
yeah.
say, not always a prolapsed disc. Um,
No,
yeah.
no. There's so many conditions that we could talk about within this. We focused usually on chronic pain, but that's not the only condition. We work with chronic fatigue, with long COVID, um, tinnitus, bowel problems, heart things. Obviously, we have to rule out any tissue damage, any specific condition. And we also need to be cautious if we're working with people with mental health conditions as
Of
well.
course. Yeah.
But luckily, through SERPA, my training organization, we now have doctors, physios, osteopaths, coaches, as well as psychotherapists and counselors. So
Mhm.
we can refer on. If we have somebody that we feel is outside our scope of practice, then we can actually refer on to one of the practitioners who might specialize in neurodiversity, for example, or
Right.
trauma, or whatever that happens to be. We include, obviously, our courses are trauma informed. We include, now before we even work with a client, we would teach them about self-soothing, so we're very much focused on somatic work
Yeah.
because many of the people that come to us have searched and searched for an answer if they're not academic, they're maybe overly analytical, and they're
Gotcha.
searching for an answer and cross about, certain things that have happened to them or not happened to them as far as the medical world's concerned. And so we really need to help them get out of the head and trying to work things out to actually being in the body. And because if the symptoms are a result of unresolved emotions, then actually the more we can start tuning in, allowing these emotions to be acknowledged and expressed and processed, then there's less fuel for these symptoms to occur. And for example, if somebody quite often they'll have a precursor to the symptom, but they may be completely oblivious to it. So often I will, that the precursor being a triggered emotion that they're just not aware of.
Right.
But what I often say is, like, for people who have migraines, usually they will have an aura beforehand. They'll have a sensation that they're going to have a migraine. That's a perfect opportunity to start understanding it and to start using what we're teaching them to just go in and do some emotional awareness, somatic tracking, self-soothing, being self-compassionate, looking at their symptoms through a lens of safety rather than fear. Because if you leave that until you've got the migraine and you're mid-migraine, I mean, I've had migraines before, all I could do is go to sleep. And I used to even be interested then as to why, when I was just relaxing and going into sleep, the pain would be calming down. But anyway, so what we try and do is say that's a time to, as soon as or that it comes on at 4 o'clock in the afternoon, you start doing something before then. But before that aura, there's a trigger. Something's triggered you. And even if you don't know what it is, to just pause and just ask those questions and sit with that and start to, we use something called pause, breathe, feel, reassure. To whenever you notice you've been triggered, or you've and by triggered that might be a pain, or it might be that you feel angry, or we're talking about anger a lot. It's not all anger,
or
there
sad,
might be
or
grief, sadness,
abandoned,
anything.
humiliated. There's lots of feelings,
So
not
many.
seen.
Absolutely. And if you're not being authentic and being able to express how you're feeling and just shutting down because that's an automatic response, whatever you're aware of, that's the time to go, okay, just pause for a moment and then calm your breathing down. So nice, calm, doesn't have to be really deep, but just slow, calm, connected breathing in and out, and gradually slow your breath down, because the first response will be a change in the way you're breathing. And so many people have dysregulated breathing that have chronic pain or have experienced trauma. So that's the go-to. The more you can tune into when your breath changes, your breathing changes, to go, okay, that's interesting. Okay, what's going on? How am I feeling? And then, so the pause, the breathe, and then notice how you're feeling. What sensations are there in the body? Not looking and thinking, what's going on? What's going on? But actually,
have I broken my other disc? No, as well.
Yeah. And searching and looking, that's actually fueling it all. Whereas if you just do it through a lens of safety, with self-compassion and curiosity, just to be okay with whatever comes up, and reassuring. And that could be just by saying, with this self-compassion, and by saying it's okay to be feeling like this. It's okay. You're safe. All's well. Maybe even sort of stroking your arms, because that's a good way to self-soothe. And by doing that every time, you develop much better felt sense, interoception, noticing that what's changing within all the time. And then you can start becoming, by learning to self-soothe and feel safe, then you can start building your capacity to actually tolerate the emotions that are surfacing.
Yeah, it's wonderful work, really. So for someone who's had chronic pain for several years, if they, come to you, or a practitioner trained in the SERPA method, can they go on to live a life free from pain over time by using these tools?
Absolutely. I think what's interesting, you say over a time.
Okay.
It can be, this work is so transformational, but a lot of it is about education and understanding. If you have an insight that helps you go, oh, wow, and everything just, all the resistance falls away of trying to find an answer and being confused and being angry with medics or whoever, whatever.
Yeah.
If you get that understandings, that then you've just shed that trying, that searching, that in for some people, it's probably a minority, but some people, the pain can just either resolve completely or just calm down. Now, what I would say is, although that can happen,
Hmm.
people have literally, a neighbor down the road I've never met before just contacted me and said, I read your book and I just wanted to tell you that the back pain I had for 10 years just went away. And I was like,
Amazing.
oh, wow, it's not
Yeah.
just my book, but just this understanding and the getting over the fear that's fueling the symptoms. But for many people, they need more than that. And what I would say is actually that's not enough. It really isn't enough, because if you continue with the personality traits that you've had and the learned
Yeah.
behaviors and
The
and your
pattern.
lifestyle, the
Yeah.
pace of life or whatever, you go back to doing exactly what you did before, the chances are, if you don't get that symptom again, and you might not, if you have a really deep belief that that was emotionally driven, you'll probably get something else
Mm.
instead.
Yeah. But I can imagine how, for some people, just the learning that, yes, my emotional repression or whatever it was in this situation caused that experience and that pain. Like there could
Mm.
be an energetic release in that knowing, for some
Yes.
people. And then if they do, I suppose, need further treatment, um, the learning the techniques and actually practicing them, and the mindfulness side of it that you described, the
Mm.
noticing, the curiosity, what might this be? And as you were saying, that approach too, I thought about Dan Siegel's name it to tame it, that if you can name, oh, I am full of grief right now,
Yes.
that's what this is.
Yes.
Or I feel really
Absolutely.
unheard by my boss and invalidated, that,
Mm.
that in itself can take some of the heat out of the feeling. And maybe
Yes.
then you do your breathing or whatever other soothing mechanisms. Um,
And
it's,
also sometimes in the language we use. So I think the name it to tame it, yeah, absolutely. And even if you can't name it, because I'm the same. Sometimes I'm unable to name how I'm feeling, but
mm,
I might be saying, well, I just feel uncomfortable or whatever,
hmm,
and sit with it.
hmm,
Because again, it's rather than just ignoring and carrying on,
hmm.
ignore, carry on. And I'll give you an example of when I ignored and carried on. And it was many years ago, I have to say, and I did learn from
You're
it, and
learning
that's
by
helping.
doing.
Yeah, learning by doing. We're all work in progress.
Yeah.
Um, but I'm going to admit this, that I did ignore, even though I knew this, it was in the early years, but I was working at my computer. I had a deadline, but interestingly, that deadline was one I'd set. And I started feeling a bit thick-headed, but I ignored it because I really wanted to hit this deadline. And I didn't want to take this work over to another time. And I just kept saying to myself, yeah, I'll have a break. I'll have a break soon when I've done this. But I went on too long
Yeah.
from that and I can't remember now what was going on in my life at the time, or why I was feeling as I was feeling for this
Mm,
to come on. But anyway, I had persisted past when I was very aware that even before I got the thick head, I was very aware that, I was putting pressure on myself.
hmm,
Um, and in the end, when I did finish, and I can't give you a time or anything, I
mm.
don't know, but I'd pushed past not just how I was feeling with, I didn't do the pause, breathe, feel, reassure. I didn't know that at the time.
Yeah.
So this was sort of early days. So I didn't know that at the time, but I did know I needed to pause
Mm.
when I was recognizing that. And uh, and then I ignored the thick head, just thinking, I'll deal with that when I'm finished. When I stood up, I was so dizzy. I had no pain. This
Mm.
was dizziness. I was so dizzy, I had to hold the desk to stand up. I actually have a sofa over there in my office, and I had to reach for things to get to the sofa. When I sat down, I had to brace my arms on the side because I would have fallen over
You
if I
nearly
hadn't.
fainted almost. Vasovagal
Not even
thinking.
fainted.
Yeah.
No,
No.
I was nowhere near fainting. It was
Yeah.
just complete
Okay.
dizziness. I could not, I didn't know what was up, down. I had to use my arms to hold me from
Okay.
just crashing to the floor. Um, but I had no fear.
Hmm.
because I was just knew what had happened. And
Yeah.
I remember just literally pausing at that point, holding on, but coming out of my head of and going into my body, calming my breathing, allow myself to feel how I was feeling. I did the pause, breathe, feel, reassure, even though I wasn't aware of that
Yes, I
process.
get you.
And I just allow myself to feel how I was feeling and reassure myself and just say, do you know what, Georgie, you're safe. You just pushed it too far, but that's okay. And
Hmm.
again, not blaming myself, just going, that's okay.
Hmm.
You know, these things happen. It's all right. Let's just take some time now. And I did. And within 5, 10 minutes, things calmed down. And then I took a proper break. And
Hmm.
I did. I went outdoors. I did some meditation. I think I probably did a bit of journaling. But I offloaded and then took time for me. So, yes, it was delayed, but I used it as a really good learning opportunity.
Yeah, excellent. And it's a good story to tell, as well, for the fact that knowledge and even putting knowledge into practice, we're not always equally good at it. We can want to override our
Yes.
sensations for
And
various reasons. And
absolutely. And just because we're trained in it and a practitioner doesn't mean that we always will do that ourselves. And it's a learning opportunity all the time. And I am much better now at pausing and going, okay, what's going on, Georgie? You've been triggered. I've been doing that today. I don't have to have a symptom to go, okay, something's triggered me. Let's sit here for a moment before I carry on. And
Mhm.
that helps me rather than bottling it up, because the more you shove it down, the more likely something will manifest, whatever that happens to be.
Yeah, thank you so much for sharing that. I think it's so, so common, whether people end up with physiotherapists or not. The intolerance for uncomfortable emotions, for fear, for worry, anxiety about the future or whatever it is as well,
Mm.
and trying to banish those thoughts doesn't really get us anywhere healthy fast.
No, no. And that was why I had so many recurring health problems myself. So coming across this work, and then I ended up going over to America to see Dr. Sarno because I couldn't find anybody over here in 2007 who was doing this work. And there was less about on the trauma side then. So I went over to see him in 2007. He was still doing a 3-day work. Even at the time, he was 87, I think.
Wow.
Um, and then I came back here and set up my own program. And from there, I started looking, finding out much more about, Peter Levine, Gabor
Hmm.
Mate, Bessel van der Kolk, and Dan Siegel, and whom I had in Ireland. I'll never forget this. Had what wonderful opportunity of doing the Irish dancing
He
with
was
him.
so funny. Yeah, that was a beautiful, beautiful night to witness all the joy and play and the joyful,
Yes,
energetic bodies in action. It was really, really
absolutely.
nice.
And do you know what was interesting there as well? That I was felt more able to show my authentic self. And when he got up to dance, as soon as the music came on, it is not in my nature to get up and dance straight away.
Right,
I have still work on my worrying what other people think.
right.
And I do dance. I love dancing. My husband and I will dance, but if we are at an event, he'll often say, "Come on, let's go and dance while there's nobody on the floor." No, 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 no. We'll
Yeah,
get
yeah, yeah,
bars when there's other people on the floor. I
yeah,
don't want everybody watching us.
yeah.
And on that occasion, that sensation of oh no, I can't came up momentarily, and then
Right.
I just said, Georgie, you won't have another opportunity like this. And I got up and I
True.
danced with him. And as you say, it was so joyful.
Yeah.
I loved it. And it
I
was
have
just
I
so,
have videos of just how happy and like he's a major sort of guru in the field, and a
yes,
serious thinker and about as serious a thinker as it can get, but the joy was just and the playfulness was oozing
yeah,
out of him and the rest of you who got up, and it was a lovely thing as well for you to overcome that reluctance
yeah,
and to seize it.
absolutely.
Yeah,
I would
really.
love to see that video.
Yeah, okay, I'll send it to you. I'm sure I still have it probably on Dropbox. Um,
Yeah.
but just because you've talked to me a little bit about SERPA, but can you tell me a little bit more about how you developed it and
Mm.
who kind of will most benefit from the method, I guess.
Yeah. Well, as I said, I came back from seeing Dr. Sarno,
Hmm.
and I returned to the States on a few occasions because a few of us got together. I think there were only about 35 of us, and I don't know how I got in touch with them all. No idea, can't remember. But we all got together for a first meeting in 2009, and then 2010, and then 2012. But all of this, I only had my US colleagues, and there
Hmm.
was no support over here. I
Okay.
couldn't find anybody who knew about the work in UK or Europe. And after spending time with Dr. Howard Schubener, who's one of the certainly one of the leaders in our field, and he's done quite a bit of the research into it, and, as well as a clinician um, and educator. And he has been a real support to me, and Dave Clark in this field as well, who's president of the American organization. And I just got to the point where I felt that in order to have more peer support over here, then maybe I should start teaching people. Apart from the fact that it was costing an awful lot of money to keep going over to the States,
Sure.
and to raise awareness about this work, for me, just working on my own with my clients was not going to get very far. I was absolutely passionate. I know this is has been my calling. There's no doubt about it. And I just had to do something. And so in the end, I decided, well, let's set up a training organization. But that was very challenging as well. And in the end, I had a couple of guys who helped me, certainly in the first year, get this SERPA set up and come up with a name. So it's basically Stress Illness Recovery Practitioners Association.
Okay.
Um,
I have the
and
card here.
Oh, and a year later, they started the American organization that initially was the PPDA. They've just changed it to the ATNS. So the Association for the Treatment of Neuroplastic Condition Symptoms. Literally, they've just changed. And I just felt that one, it would give me peer support. It would give me an opportunity to have people to refer on to, like
Sure.
psychotherapists, and it would help raise awareness more. So I set up SERPA in 2010, and initially was going around the country running courses, and then realizing it wasn't very sustainable doing that.
I
And
agree.
in the end, I think there are a number of reasons. That one of them, that my dad was not well at the time,
Okay.
and I just thought, gosh, what if something happens, while I'm running a course? And initially, the idea was train some of the more experienced practitioners, but in the end, that clearly was not going to work for various reasons. I just thought, okay, now's the time to move it online. And somebody had started working with me who had worked in the corporate world and developing courses. So law of attraction, that was the right time for her to come and work with me. So Zoe and I worked on it to actually move the training online, and it meant we could have more in-depth work. We could do a lot more, and it freed me up to provide a membership for the practitioners who trained, and they were all asking for more support as they started working in this field. So we now have I've literally just this year we've launched a more in-depth comprehensive training. It's nearly 100 hours,
Wow.
3 levels. The final level is just for practitioners to do. And we have a really strong membership, very supportive. It's more like a family, just such a supportive membership where we have lots of peer support available. We have clinical supervision. We have annual CPD weekends, which are fabulous. And it's just a really supportive network. And we're mostly in the UK, but we do have people in Europe as well as Australia, New Zealand, and America. And it just means that we can reach more people now, and we have
Sure.
people from different backgrounds. So there's always somebody who can find someone with the background that whether that's a doctor, psychotherapist, and various different qualifications that can help people. And then anybody who feels, most people work online, and most people offer free discovery calls, so that you can always sort of talk to somebody and see have some questions answered for free,
Ah,
and see
okay.
whether it's the right route to go down, first of all.
So, depending on where someone lives in the UK or Ireland, you could then do some of the actual treatment with the SERPA trained person online, is it? Am I understanding correctly?
Yeah, Yeah, I
Ah,
mean,
right.
some of them do physical work as well,
Hmm.
and we have had people who trained in Ireland as well. And it might be that somebody wants to visit, but if they can't visit,
Mm.
then you might say that I think we've just got a couple in Ireland, but let's say they've not got the experience that somebody needs for their condition
Mm.
or whatever, then it doesn't really matter because the work online is just as effective. And it means that you can reach out to whoever you feel is a good fit, the best fit for you,
Hmm.
rather than just your locality.
That's really fascinating. And, I can imagine how some people, because pre-COVID, no one really did stuff online. Like there were a few courses
Mm,
or meetings online, but that has revolutionized, I think, how
it
people can
has.
access services. And I know
Yeah.
that, some luminaries again in the psychotherapy field to say for some people, this is a really good format
Mm,
for accessing needed supports. For others, it mightn't work so well. They want to be in the room or it's better for them. But I
mm,
know deep brain reorienting that Frank Corrigan does a lot of that work online and says it works really well. And I can see as well if someone is crippled with pain over many, many years
mm.
and might feel fearful of navigating the tube or leaving their
Yeah,
house even
absolutely.
that the prospect of getting any relief from
Yeah.
a modality online is huge. And so would most of the practitioners as well offer this discovery session? I think you called it.
Yeah, I think nearly
Yeah.
everyone these days does
Okay.
offer a discovery session
Okay.
because a lot of it is also about, not just
Intimacy.
has somebody got the right background, but yes, how do they get on with each other? Do they feel it's the right person? And so you can always have sort of two or three discovery calls with people to feel that you've got a good fit with somebody you trust because that you're going to be talking about quite significant stuff here, and it's good. You need to know that you're working with somebody who's you feel you can really deeply trust, and sometimes that takes time. And
Hmm.
it might be down the line things you feel like you can trust them more, but I think this feels more like it's mentoring,
Mm.
mentoring somebody initially and then moving on to sort of maybe coaching and encouraging them to, to start not just practicing themselves, but not you. What we don't, if you're going to see a doctor or a physio, you're going for them to sort you out, yeah,
Mm.
to
Mm.
treat you.
Mm.
This is very different in that we can support and guide you, but
Mm.
you're the one that needs to do the work. And so this is much more about mentoring and educating, guiding,
Mm.
teaching some of the strategies, advising, and then maybe they come back and okay, how did that go? What was going on? And you go with whatever's presented. So for some, I remember working with a guy on one occasion, and we'd done the assessment and we were going to move on to work on something. I can't remember what it was now, but something about his relationship with his parents. We were going to do the following weekend because there was a reason to do that. But
Hmm.
he turned up, and he was somebody who came to my practice many years ago, and he turned up, and he was so stressed about something happening at work.
Mm.
Now he's not going to be able to concentrate on doing stuff about parents,
Mm.
but so what we did was we looked at what was happening in that moment and what he could do, whether it was journaling, whether it was breath work, self-soothing, all sorts of things that we could encourage in that moment. And journaling actually on that occasion was a really good thing for him to do because he was able to write an unsent letter to her,
Mm.
and express how he really felt because he was a nice, kind person who couldn't express how he felt. So he was able to really express it, and then he could rationalize it and
Mm.
really reframe it and look at what he could do then moving forward that would be helpful. And from doing that, he learned the skills to deal with other things that might come up in his life. And he transformed that relationship with that woman in the office because you
Wow.
work on yourself, they change too. You often what we see in other people is often what can be hidden within us. And
Hmm.
then we work on us, and the way we react, that can often change how that other person shows up for you as well.
It's so unbelievably fascinating. When we were talking about the chap there and not wanting to upset his mom, I was thinking about Gabor again because when talking about attachment and authenticity, a lot of
Mm,
our loss of authenticity is because we want to stay connected to our primary caregivers in the first instances, and if they've
yeah,
been erratic or volatile or emotionally abusive or just somehow fear-inducing, then it can be
yeah,
very hard for us to say what we think or feel. Um,
definitely.
and that's so common, really, in various ways
Hugely.
that
Mm,
we don't even realize as adults. It's kind of how can that still be playing any class of a role in how I show up in the here and now? But of course, we don't want to be disliked or have people reject us in any
mm.
context. And so, is journaling in general or writing letters to whoever the person is, the boss or the ex-partner, is that a way of working through old wounds and repressed emotions in general?
That's one way, absolutely. We use a lot of somatic work as well.
Hmm.
And lots of other ways that we can work on that. But journaling can be a very quick and easy way to do that for some people who are not good at accessing how they feel.
Hmm.
And ideally, we want to make sure that they learn about breath work and self-soothing and dealing with emotions that come up, so they know that they don't need to get scared when this emotion comes up because they've been learning to self-soothe and cope with these emotions. But writing, I mean, journaling, there's lots of different ways to journal, but writing an unsent letter, for example, whether that's to your father from you as a child or your father from you as a teen or both, as well as an adult, can really help you acknowledge and express how you felt at that time. And then after really working on that, to then look at maybe writing an unsent letter back from that person, or write an unsent letter from you now to your young child with the
Oh,
awareness
lovely.
that you have now, and soothing that child and recognizing, yes, no wonder you felt like that. And yes, but have you considered, what your dad, why your dad was like that?
Yeah.
And it can be transformational when people, as you know, when people really are able to not just feel like that, yeah, well, he was abused, but
Mm,
I've changed. Why can't he change?
mm, mm.
No, not all of us can.
No, and
And
not all of us, I suppose, get the education, which is why
absolutely,
psychoeducation is so powerful. That's the
yeah,
first step in noticing some of the patterns or the ways of behaving or
yeah,
showing up in the world. And then as a parent, being able to catch yourself or even realizing, I think, the power of repair. We all
yeah,
rupture relationships or can do, but
mm,
very often for people, there has been no repair along the
mm,
way with their parents or with their own children. So to give people a language around this, I think is
yeah,
wonderful, really, and just tuning into their body in various ways, because I can see how writing, and expressing all the pent-up emotions could again
mm.
just have a huge release in the here
Oh,
and
it
now,
does. And
expansiveness.
that
I can see it, how it
And
could.
that was that was the main strategy that Dr. Sarno used with his clients:
Okay.
education and journaling. And because at that point he was unaware of meditation or self compassion or anything like that. But so he had amazing results from clients through education and journaling. And if anybody struggled, they would refer on to one of the psychotherapists that he worked with.
Hmm.
But interestingly, those are now working more in a somatic way as well, rather than to
Mm.
just talk therapy.
Yeah.
So journaling can be absolutely transformational, and especially if you don't just offload, but you really, offload. There's a lot of evidence around journaling and how effective it can be for our health and well-being, emotional and physical.
Mhm.
But not just because I think for people who say to me, "I'll try journaling, it doesn't work,"
Yeah.
what they've often done is just offloaded about how miserable they're feeling every day,
Right.
expressing how they're
Yeah.
feeling, which is actually the thing.
Reinforcement.
Yes, reinforcement, neuroplasticity. Let's just keep reinforcing that
Yeah.
you're miserable.
Yeah.
So I don't mean to be
No, but
general like that.
yeah.
It does reinforce it. Whereas actually, if you do, acknowledge and offload how you're feeling, but then you look at, okay, what can I learn from
Mm.
this? What can I feel grateful
Mm.
for? When you really look at it in by reframing it like that, and
Mm.
okay, so what can I learn from this? Actually, yes, I can see now that my dad didn't have the awareness and understanding that I've developed,
Mm.
and he must have been really traumatized by what happened to him as well. But
Mm.
they might never have considered it in that way.
Sure.
But when you do, you can turn that parenting around. I so wish I knew what I know now when
Mm.
my kids were little.
Yeah.
But at least I learned it when they were teenagers.
Yeah.
But I can still see the damage. Damage.
Yeah. Yeah.
I don't mean that, but I often say to my kids, oh well, you know all about it now. I'm sorry about what I did. You know all about it now. You can sort yourselves out.
Yeah. Yeah. You have all the tools. You can
Yeah.
you can
But when
consult.
I look at, for example, my niece bringing up her three, it's like, I'm so proud,
Mm.
of really looking at, okay, what can I do differently? Because, my generation, we were very much brought up, children should be seen and not heard,
Mm.
and do as you're told, and look nice, be nice, speak nicely, be polite, and whatever, and being treated all the same, even though
Yes.
we were all completely different. And
Yeah.
she treats all her children differently. She's got Dan Siegel's books,
Yeah. Yeah.
she's
Well, she's
really taken
got
on
us
board all my work
access
as well.
to
Yeah,
great information, and that's it. I mean, we can sort of transform the world little by little in our little patches by sharing what we know and sharing tools. And okay, journaling mightn't work for someone else, but body scans and breath work really might,
yes,
so
yeah,
that I suppose is part of it as well, the curiosity of trying things and saying, well,
yes,
but just with the chronic pain, people who might have, tried so many things and gone for
mm,
so many physical interventions and been to the doctor so many times and all these tests, is there
mm,
kind of a weariness as well around even trying something new? Or like, are people
yes.
told to kind of accept the pain sometimes and just deal with the depression around it and accept that it may never leave?
That would be going down the pain management route,
Okay.
which I'm not into.
Okay.
Um, but absolutely, people get weary and they're scared to hope,
Yeah.
which is a shame because hope is very important, developing hope.
Hmm.
But this is where our books come in, whether it's Dr. Sarno's, mine, we've got loads of books in this field now. And relating to yourself when you're reading the book, that's where transformation comes. It's
Hmm.
beginning to, I've got a TED talk, listening to the TED talk. And for some people, that's interesting. Maybe I'll read a book or read one of the books in our field.
Yeah.
That can be really helpful because to recognize that you might have been, to all corners of the earth, and many people have, searching for an answer from people who are treating the symptom. And
Hmm.
if you're going to carry on treating the pain, whether that's surgery, medication, or exercise, or whatever that happens to be, rather than looking at what's the underlying cause
Mm.
and looking at moving on then to look at what were the preceding factors, what are the factors that were involved in why you developed the pain, whether that is trauma from your childhood or your personality, the learned behaviors, stress that you've been through, a divorce or whatever. Look at those predisposing factors, basically, then starting to look at what are the precipitating factors, what are the triggering factors, as well as what's causing the pain to persist.
Mm.
And if your pain, you've been treated physically all the time, you won't be looking at
Mm.
underlying trauma, underlying stress,
Mm.
your personality traits.
Mm.
And you know what? One of the studies showed that by looking at their individuals' personality traits, they did a personality profile beforehand, then they put them through a placebo car crash. So
Wow.
they actually built a car,
Yeah.
but they knew that the speed that it then, the impact when it stopped, could not possibly cause any tissue damage at all. After that, 10%, 20% initially developed whiplash,
Oh, wow.
10% had it a month later. And they proved with 88% accuracy, they were able to determine who would still have pain a month later by their personality traits.
Fascinating.
Okay.
And
So
what
it
type of
is.
personality traits were linked to the pain?
Well, just things like very a caregiver,
Uh,
perfectionist, overly analytical,
mm,
those sort of things
yeah,
are going to mean that you are trying too hard or you're in your head all the time, needing to be in control,
yeah.
needing to be perfect, needing to be right.
Mm,
All these things create stress that then can, at some point, at the tipping point, could manifest in pain.
mm,
So all these things, if they're not being looked at, then of course the pain's going to be managed. You can, and all the pain management clinics
mm.
do quite well. Some of them do well with pain management, but that's curtailing people from living their life
Yes,
with
that's not
joy
really
and
a life.
no, and being able to do what they want to do. But they have their whole understanding about the cause of their pain has to shift. And
Okay.
then they have to work on any doubts and their fears and then look at what are the factors that are causing their pain to persist.
Hmm.
And that's very possible. We've had people who've, had chronic pain for decades who've recovered. And it's not, and the length of time somebody's had pain does not determine whether how long it takes to recover.
Yeah,
That's
great
why
point.
right at the beginning I said,
Great
if you, in
point.
fact, if you're told that it takes a year to recover, it'll probably take a year to recover. Okay, because beliefs play a huge part in this.
Right.
And there's one of a book, I don't know if you've heard of it, The Expectation Effect,
No,
by I think it's David Robson.
I'll have to check
It's
it out.
fascinating.
Yeah.
We predict things, and if we believe that bending is bad for us, we'll get pain when we're bending. And the more pain we have when we're bending, the more likely we'll have pain when we're bending. And it might be that it was just an unconscious belief that, well, we know that bending is bad for the back. That's why we have to have manual handling courses. That's actually been disproven because they
Right.
don't reduce the amount of back pain. But the more we believe that, then if we're going through a very stressful time and we bend over and even just pick up a pen and get pain, then that then reinforces that belief. And then that becomes a predictive coding
Yeah.
effect on the brain, that the
And
brain will predict pain
I
every time we
guess
bend.
then, sorry, Georgie, I guess that's what the story will tell ourselves then is that we bent
Yes.
over, picked up the pen, and that's what caused our
Yes.
back pain rather than whatever else.
And every physical person, whether it's physical therapist or doctor who's not trained in this, will have to think of a physical cause. They won't be. How can you be aware of another cause unless you've been trained in it or experienced it
Yeah.
yourself, for
Hmm.
example?
And just to go back to the training that you do again, it's not just for physiotherapists, is it? Anyone
No.
who is it suitable for? You mentioned doctors. Who else might be interested in doing it?
So, any health professional, coach, and holistic therapist can do certainly level 1 and 2.
Okay.
That's what we call SERP informed. So, you can
Hmm.
inform someone, you can provide advice and guidance and point them in directions of places that can help.
Hmm.
The level 3 is our practitioner course, and that's for health professionals,
Okay.
mental health professionals, and physical professionals, as well as coaches who have done a decent diploma, at least 6 month diploma, where it's included doing case studies and having supervision,
Okay.
because they need to be experienced in supporting and guiding
Hmm.
patients through
Makes
this. And then
sense.
this course increases their scope of practice as well. So usually what we say is if somebody looks at the course and they want to do all 3 levels and be a SERPA practitioner,
Mhm.
then if their profession isn't there, we'd just say get in touch with us, because sometimes there's other things that they've done that might mean that they're eligible. But
Mhm.
eligibility really is to be a health professional or a coach with who's the minimum level of training, but also their training, anybody's training needs to mean that they're regulated by their health professionals
Sure.
regulatory body and insured to work with patients.
Yeah.
And that's to keep them safe as well as the clients safe.
Of course, there need to be standards and safety
Yeah.
protocols for all of this. Because to some people, I guess it could not sound dippy hippie, but uh, because there is lots of science behind it, from particularly
Yeah.
when you start bringing it together from lots of different fields. This is not
Yes.
there at all. It's just if they haven't been educated in it, it might seem, oh, why are they talking about emotions and not cracking
Yes.
someone's back or whatever else, looking at
Yes.
scans. So,
Absolutely. And thankfully the pain science is evolving. So it's really showing that there is more to this than
mhm,
just cracking a back, and that we need to look at past experiences and all sorts of things. So we're getting there.
mhm,
There's still further to go to really start including past emotions, unresolved emotions, trauma. But the pain science is really a lot more supportive now. And then the trauma science is filling in the gaps.
mhm.
So all of it together is really supporting that what we're doing is effective. And we've got our own scientific studies that have been undertaken in our field as well that's showing fantastic results
Mhm.
compared with the standard CBT, for example.
Mhm.
It's really there's more and more studies being undertaken that are really demonstrating it and showing now the demonstration of neuroplasticity, that by working with chronic pain, doing pain reprocessing, then we can actually help people not just resolve their pain, but the neuroplastic brain. It shows that the brain
Yeah,
is
we're
changing,
rewiring it as
rewiring it all
yeah,
with
yeah.
healthier neural pathways, circuits. Yeah.
It's amazing. I've just one further question for you, Georgie, and I ask this one to everyone. It's kind of very broad, but what do you think policymakers and politicians can do to, I suppose, improve the prospects that all children will grow up to have, the capacity to have joyful, energetic bodies, to use Deepak Chopra's phrase, because I experienced it during COVID myself that my body didn't feel as joyful or energetic. It felt kind of stuck and tense. And then it's such
Yeah.
a lovely thing when you feel that kind of energy flowing again.
Mm.
But as we've been discussing, not everyone has equal opportunities for various reasons for that. So is there anything that we could do, or politicians and policymakers could do, to enhance the chances that all children would
Mm.
grow up and just enjoy their bodies?
Well, it is a big question. And we know that scientific studies can often take 20, 30 years before they even see the light of day and have an impact on things. But apart from, I'm working with people, adults who have the impact of their childhoods. And I do feel that we need to start in childhoods and maybe schools that don't have smartphones.
Hmm.
I think that certainly needs to happen. And there needs to be more education and awareness of not just the health professionals, but the schools, the teachers, as well as parents, for them to understand.
Hmm.
And it's going to take time.
Do you think that learning, I know that schools have stuff around social and emotional learning, but to actually really tune in more to the fact that emotions are messages about how safe our
Yeah,
bodies feel in the environment, and that no emotions are really bad. It's okay to be angry. It's not okay
absolutely.
to lash out. It's okay to be sad. It's okay to feel grief or fear or whatever.
Yeah,
And that they pass,
yeah, yeah.
with something
I,
like
I
that
mean,
valuable.
yes, that's all part of the education.
Mm.
And absolutely, parents should be able to learn this. Schools need to learn all this. Doctors need to learn all this. And also recognizing that people need more than just a quick 10-minute appointment. Somehow within the NHS, they need to recognize this as
Yeah.
well.
Yeah.
But to
Okay.
start with, certainly with children, and that's all about the education to help them understand all this, because that once they learn that they can allow emotions to pass through, and not to send them to a naughty step or a naughty classroom or whatever that
Yeah.
happens to be, but actually really getting to the bottom of all this is important. I think it's a challenge. I don't know how. I think it's going to take time, but hopefully it's going in the right direction. I do believe it's going in the right direction.
Yeah. Okay. Well, look, Georgie Oldfield, thank you so much for joining me. It's been really delightful and a wonderful learning experience. I know people will find this very interesting. So thank you so
Good.
much for joining me on Relationships Matter. It's been wonderful
Uh,
having you.
Thank you. It's been fun.